Hi, I'm Dr. Bart Bonazinga. I'm one of the cardiologists here at Rutland Regional Medical Center. When I was very young, I wanted to become a doctor because I was very interested in biology and science. I found it fascinating, and later on I found out working with people would be very rewarding. From my earliest interest in science and biology, the heart fascinated me, and the way it would beat all by itself. And I always wanted to be a cardiologist. Even when I was first in college, took biology and all kinds of different biology courses. And when I went into medicine, it surprised me that everybody didn't want to become a cardiologist because of the way the heart was so fascinating to work with. This may sound offbeat, but as the patients live longer and longer, they need more and more cardiologists. So I see the cardiology field just getting better and better and more rewarding and more rewarding. As an example, 25 years ago, we would have a code 99 every day where somebody's heart would stop and have to be started, and we would have one massive heart attack a week where the patient probably wasn't going to make it. And now if that happens once every 6 months, it's a surprise. That's how good cardiology care is, including Rutland. When I first arrived here in Rutland, there were no other cardiologists. There was nobody to take care of heart attacks very well. There was nobody to put in pacemakers or special procedures on the heart. There was nobody to look inside the heart with echocardiograms. About my third night here in Rutland, a patient came in with a heart attack, and when I saw him, he was deathly ill with a heart attack. It was quite obvious, and we really couldn't move him anywhere, and his heart kept stopping. So naturally, we took him down to the radiology department to put a pacemaker in. And every time, after I put a tube into his heart with a pacemaker on it, his heart kept stopping. And every time I got the pacemaker into place where it would fire and take over his heart and keep him alive, he would then go into a life-threatening fast heartbeat. And every time I pulled it back, the patient's heart would stop. And every time I put it back where it was supposed to be, it would start up again. And that went on for about an hour. And he is still alive today at the age of 86, which made that day he was 50. And he actually still has his pacemaker that's working fine. I really enjoy being on the radio every 2 weeks with Tim Philbin discussing all types of medical issues, including cardiology, because I get to look up all kinds of stuff on the internet, learn a lot of stuff, and then discuss it with a good host who's entertaining in his own way. So I really enjoy doing the Dr. Bart the Heart Show, and it's a great learning experience. I feel that I am an ambassador for the Rutland Regional Medical Center and the Rutland Heart Center. Everybody I run into is a patient or has a family member who's a patient, and I treat everybody like family because that's the only way to be compassionate and do it right and always cover all the important medical issues that need to be done. The things that float my boat when I'm not working is my incredible list of hobbies. I make furniture, I carve decoys, I go hunting, fishing, build boats, build turkey blinds, fish, tie flies, go fly fishing, hike, train dogs, raise dogs. So I'm very busy. Rutland was fabulous when we got here. It was a great place to raise kids. I could drive 6 minutes and be in the country or in the woods. And if 3 cars in front of you were stopped at a stoplight and it turns green, nobody beeped. At least not then. Now they do. But the people are great, and I have, as I've gotten older and getting closer to retirement, I think I will stay. And I would do it again.